everybody, I'm Stephanie. I'm with 9 Health. We're here at the University of Denver today. We're talking to a couple counselor psychologists. Well, I'll let you know who they are in just a moment, because we're talking about mental health and cancer diagnosis, specifically breast cancer diagnosis, because it's Breast Cancer Awareness Month. And all this month we're focusing on breast cancer. We're actually following the journey of Dr. Michelle Tollefson. You'll find her story on our blog and on our Facebook page from last week. We're kind of just posting her journey through the whole process: diagnosis, treatment, recovery, the whole thing. I'm out of breath already. Like, I was moving around getting the camera set up. I am alone today, running solo, so I'll be going back behind the camera to see if you're asking any questions. So let me know if you have any questions, and we will get those answered. But we're with today Drs. Andi Pusavat and Dr. Trish Rocky Bogdan. Did I say it right?
You said it right.
They're both, again, at the University of Denver here, and they're professors, but they're also counselor psychologists, so they know a lot about mental health. So I wanted to sit down with both of you today and just kind of ask you some questions about, getting a new cancer diagnosis. We always think about the physical part of it, especially with breast cancer, surgery or whatever's involved to, help treat breast cancer. But there's a lot of mental health aspects as well. So first, Dr. Pusavat, being newly diagnosed with any type of cancer is going to be mentally draining on anyone. It's going to affect your mental health. So how can a breast cancer diagnosis specifically affect your mental health?
Sure. So there's many ways that it can affect your mental health, and one of the main ways is that people who initially have a diagnosis initially often experience it as a traumatic event, and so the American Psychological Association has identified that as well as a traumatic event. And so what happens a lot of times is that people will experience increased depression, anxiety, feelings of isolation. They'll also possibly experience just a sense of kind of having their own experience that people can't relate to. And this is especially true for men and for young breast cancer survivors. They oftentimes will talk about how that's something that kind of sets them apart from what people usually think of when they think of breast cancer diagnoses. So those are some of the initial kind of shock and overwhelm are the initial kind of reactions that people will experience. But there's a wide range of intense emotional reactions that people experience, and that should be expected. Right. There's a lot to think about in terms of appointments. So oftentimes people have upwards of 100 or more appointments in their first year after they're diagnosed, and so coordinating care can be incredibly important. And when you're feeling depressed or anxious, that can make it difficult to really take those steps to take care of yourself.
Right, and it's just, it's overwhelming because you want to make sure the physical part of it's taken care of, but you also need to make sure, you're okay as a whole patient, a whole person. And Dr. Rocky Bogdan, you've done some research with young breast cancer survivors, helping them thrive through their cancer journey. Talk a little bit about the research that you have done. Like, how have you noticed that someone would thrive after a breast cancer diagnosis?
Yeah, so like Andi touched on, I think getting that diagnosis and initially there's a lot to process, and that can create a big shift in their worldview, their understanding of thinking about why things happen. And a lot of times coping, what we see is it can involve meaning making, trying to understand how their cancers came about, how to try to explain it, make sense of it, try to get a sense of how it affects the way that they're thinking about their purpose in life and their relationships, and sometimes also their work lives. And so those are the type of aspects that can really be coping strategies if they're able to get to a place where they're able to find meaning. And so I think that initial diagnosis, knowing that first year in particular, is where we see those higher rates of depression and anxiety, and they tend to decrease over time for folks. So I think when you're connected to cancer care centers, often you're getting a lot of touch points, you're having a lot of appointments. It can feel like you're more in control of where things are going, and that can be a source of support and coping. And so that meaning making happens, the reappraisal of relationships. A lot of times I hear folks talk about intentionality, and cancer has prompted them to really be mindful of how they're spending their time and their energy, and sometimes wanting to make every moment count.
Right.
And that can be helpful and a good thing, and it can also put a lot of pressure to
That's
make
what I think
every
about,
single minute count. So with the meaning making, we see if people can get to a place where they identify meaning from the experience, they tend to be coping better. If they're still engaging in a process of searching for meaning, that can be challenging and create distress.
Right, or thinking that whatever they're doing isn't meaningful enough, or it's not. Yeah, it probably depends on your personality prior to even getting a cancer diagnosis. But
And that's a big part, I think, thinking of how people react, recognizing you have a whole life that you've lived, and experiences and salient aspects of your identity, and then you get a diagnosis. And so you're bringing that whole aspect of your life into how you're reacting to the diagnosis. And so I think that's another part to keep in mind. And and like you're saying, the younger age, and then having other mental health concerns before a diagnosis, that can make things complicated. In terms of coping, though, the meaning making is one part, and then what I see often is the impact on relationships as well. So people might have this intentionality of how they're thinking about their life roles with family, partners, friends, workspaces. And if cancer is getting in the way of them enacting what they want those life roles to be,
Right.
that can create some major challenges and distress. And with relationships, you mentioned isolation as well. I think for young survivors, having this diagnosis can be really unexpected. They're
Right.
not how they were anticipating their life to go.
Yeah.
And so it can be hard to find places to process that. I think connecting with other breast cancer survivors, sometimes a lot of the supports that are out there might be where the average person coming in to seek those services, such as groups, are folks who are older, and so they might be confronting different issues around life
Yeah.
stage. And then I think comparing to peer groups, it can create difficulties in relating to your same age peers when what's top of mind for them might be very different than for
Right.
what is for young breast cancer survivors.
And just making time for it all. Like a young breast cancer survivor might, be busier with work or kids or family or whatever's going on. So having a lot of different directions that your life's kind of pulling you. I'm going to make sure we're good and going. And if there's any questions, again, you can ask them. Looks like we're good. I'm seeing if anyone has any questions. Again, I'm running solo today, so if anyone has any, ask them, and I will come and see. People are just saying thank you for the information. And someone did say, they've been struggling with the mental health aspect after their bilateral mastectomy. So that's part of it too, is the physical challenges that go along with a breast cancer diagnosis and treatment. Those often lead to mental challenges because of, the way you're left physically. So maybe both of you might be able to touch on this, but kind of just talk about coping strategies maybe with that, and what people experience.
So one of the reasons that seeking mental health support is so important is because women, they've gone through these life-changing and kind of body-changing experiences, whether it's through a lumpectomy, a mastectomy, chemotherapy or radiation. And so not only processing those feelings, but also kind of working through new relationship with their body, and that can affect sexual health. And there's a lot of help that's available for those kinds of issues when they come up. And so, of course, if it affects your sexual health, that may affect your relationship, your intimate partner relationship. And different ways to think about that and to work on that are to learn different coping strategies. So in individual therapy, oftentimes people work on skill building. They'll learn things like relaxation. They'll learn to meditate. They'll also learn breathing, things that will help them feel more comfortable in their bodies, but also to give them a sense of peace and relaxation while they're going through treatment. And so when they're experiencing these different symptoms and thinking about their body differently and having to navigate that and think about kind of what does it mean to them to have a different body than they were expecting to have and that they did have, to have somebody to process through those feelings with can be really important, and to learn different strategies to better kind of navigate the feelings.
Right. And then talk about just finding those resources as well for a cancer patient. So, you're talking about the different issues that might pop up, and, who should someone talk to if there's someone watching this that's just starting their cancer diagnosis treatment? How do they make sure to find those resources?
So a lot of different options. I mean, I think trying to make sure that's part of the cancer care they're receiving. And so having those conversations with the medical providers and seeing what might already be built in to where they're receiving treatment around the physical aspect is a place to start. Often there's social workers or psychologists or master's level clinicians who are there, can help navigate connecting to resources. I do some work with broader advocacy organizations, and so there's some that are focused on, like Young Survivor Coalition is one that comes to mind, who's directed at young survivors.
Okay.
And they often have local chapters, so even if your cancer center doesn't have a support group that's maybe focused on an aspect of your identity that's really salient, then that can be something you can seek out. Same with for LGBT cancer survivors. There's also some national level organizations that are trying to help make sure people are getting their unique needs met in those spaces.
But it's also just, bringing it up and voicing any concerns that you may have, which is tough for anyone dealing with any mental health issue, whether it's cancer related or not. Maybe you guys can talk about that too, like just finding the courage to say something to your physician or your oncologist or bringing it up to a medical team.
Sure. I mean, advocating for yourself is really important, and it's also, I think, a key part and role that family and friends can play. So asking for what you need, but also that can lead patients to have a sense of empowerment, which is really important, and to feel like they're active agents in their own treatment. So sometimes that can come up when folks are asked about kind of how their medications are affecting them. But I would really encourage people to state kind of what their needs are, and then also talk with, as Trish was saying, both the social workers but also the medical providers. Physical therapists oftentimes too can help in providing resources and things like that. And then, one thing that I found that's really important is when you look online, there's some major cancer centers like MD Anderson. And if you look on their web pages, you'll see kind of a host of different online resources as well as just different resources in their local community. So here in Denver, and maybe you want to talk to that.
Well, I was going to add to that piece. I think often the first year, the data shows that is when often the distress is the highest.
Yeah.
But knowing that's often when you're really you're focused on those appointments, you're focused on what's right in front of you. And so sometimes for folks, it's not until a couple of years out that they're really starting to engage in processing their experience, and things might be able to slow down a little bit so that they can. And so I think knowing that it's important to seek support throughout, across time, and know that those needs are still really important and relevant.
Right, not just during the initial diagnosis and treatment, but as you progress.
Yeah. And I think too, there's a lot of, we get a lot of societal messages about what cancer survivorship should look like and how folks should present.
Right.
And I think it's great that there's the awareness piece, but that can also be internalized as, if I'm struggling, I'm not being a good survivor.
Right, like I survived, I should be happy, I should be...
All the shoulds.
Yeah.
And so that can create aspects of isolation and loneliness and disconnection. And I think the caregiver part too, we often see survivors who are trying to really put on this front, this brave, survivorship, optimistic, I see the good face. And their caregivers might be doing the same. And so a mental health provider can be a space for a survivor and for a caregiver, all those affected, to really share that authentic reaction and to process grief. And I think that's really important, to have a space where you don't feel the need to protect another person from how you're truly processing the experience.
Right. Right, and again, it's Breast Cancer Awareness Month. We're talking about your mental health regarding a breast cancer diagnosis, treatment, survivorship. If you have any questions, go ahead and post them. I will come around and look at those in just a minute, and we'll address any more questions. But we talked about caregivers. For caregivers and family members who have someone that's been diagnosed with breast cancer, what should they be looking for too? Because it's on the person who's been diagnosed to kind of know how they're feeling mentally and maybe reach out for help. But sometimes maybe it's a family member that needs to say, "Have you checked on this? Have you talked to this person? Have you found help for anything?" So kind of talk about what people around those that are dealing with cancer should look for.
Sure.
I think support is helpful always.
Yeah, it's good to have a support system. So hopefully if you're dealing with cancer, you have a support system around you in the first place.
Absolutely.
It can be tricky because some of the side effects of treatment can create symptoms that are very similar to what we see
Kinda
with
like
depression and anxiety. You think of sleep difficulties or just pain or appetite changes, things that we're often looking for as mental health providers is indicating that there's a mental health concern going on. But I think if those are recurring and if it's really interfering with functioning and interfering with people being able to engage in the activities that are important to them. So I think when in doubt, seek support.
Absolutely. Yeah, I think too, as Trish mentioned, those depression and anxiety symptoms, so when people are feeling sad more days than not, which of course is hard to kind of differentiate from their initial shock of diagnosis, but also if they're having trouble going outside or if they're isolating or not connecting or doing the things that they used to do or enjoy. And that can be difficult to figure out when you're thinking about kind of the functioning with the treatments, but also with medication. So I think it's important for family and friends to also think about ways that they can help. So not just waiting for the person to ask them, but also asking specific questions about, would it be helpful if I, did meal prep with you. And I think there's a lot of considerations around those kinds of things. But when we're talking about looking signs to look for, you really want to look for how it's impacting their daily life and how they're dealing with that. And a lot of times the people that know us best can help us kind of get a sense of perspective when we're not feeling well. So we know that that breast cancer survivors and breast cancer patients do much better. Their outcome is much better when they have supportive partners and family around them.
Right.
Yeah.
Well, and even Dr. Michelle Tolleson, who's she's a physician and professor that we're following with her breast cancer journey. She reached out to us, wanted to share her story. She's a mom. She has a lot going on. She wants to go to the pumpkin patch. She has all these things she's looking forward to with her support system. And she's at the UC Health campus in Fort Collins, the cancer center there. And she was lucky in the fact that they were like, here's all the resources available to you. A mental health professional is one of them. Take advantage of it. So again, for people who are kind of just joining us, kind of restate why it's important for someone who's going through a cancer diagnosis to not only focus on that initial treatment and the physical aspect, but the mental aspect as well.
I mean, I think the why it's important is it can affect all aspects of our identity.
Right,
our
we were even talking about it
well-being.
affecting your treatments, and how well your body responds physically.
Just even being able to stay present and control stress around how you're receiving treatment and responding.
Yeah, I think I would add too that when people are struggling with mental health, it can get in the way of them doing the things that they need to take better care of themselves and to fully engage in treatment. So, for example, if people are dealing with fatigue, which is really common for folks to talk about, they might not feel like getting up and going to their appointments. And so, between treatment compliance, but also following kind of the physician recommendations, going to physical therapy, all the things that you may not feel like doing, but once you're there, you feel much better and get some benefit out of that. And so I think tracking that, but also if you have pre-existing mental health concerns, it's really important to be aware of that and to be aware that those are likely to exacerbate when you've been given this diagnosis and then you're going through the rigors of treatment and kind of trying to figure out what that means for your life. So,
so if you've battled depression, anxiety beforehand, it'll likely be exacerbated with breast cancer or any cancer diagnosis.
Yeah, and also a lot of cancer patients and cancer survivors are also likely to experience post-traumatic stress disorder symptoms.
Right.
And so, those are the things that can get in the way of people really engaging with healthy eating and exercising and all the things, that might help them feel better. So.
Right. Let me see if we have any questions, and then we'll kind of ask these ladies some final questions. Someone did say that other breast cancer patients were the best support for them because they've been there, gone through that. That's pretty much the only new thing that's gone on. Someone talking about just talking with other breast cancer patients. How do you guys know to connect with different breast? Like, is it something with they're in treatment with someone they see and they've connected with them? I know there's Facebook groups for different conditions and things. How have you seen people connect with others?
That's where some of the online resources that are more targeted to specific types of cancer or age groups can be really helpful.
Okay.
I think for folks, if spirituality or their faith is an important aspect, that might be spaces also to connect. Those are what come to mind immediately.
Yeah.
And there's lots of different groups often that cancer centers are providing, and typically some of them are more skill-based around coping or mindfulness or self-compassion is another aspect that I think is really important, that being kind to ourselves and treating ourselves with compassion throughout the experience is a key coping strategy. But yeah, I think connection can come up in unexpected ways. Sometimes folks do. I've known folks to do dragon boat teams, and that's been a really empowering space where they're connecting with other survivors and in some ways reconnecting with their body in a new way. That feels very empowering. Yoga space, I think finding those passions and just if there's ways to bring the cancer identity into that space in a way that's meaningful, that can be really helpful.
Is there any other tips as we kind of just wrap up here? And if you have any other additional questions, you can post those and I'll get them answered for you later. But are there any other additional tips that you would give someone who's been either newly diagnosed or maybe comes to you at the end of their journey, not end of their journey, but they've been a survivor and it's been a few years later, we've talked about too. Any other kind of general tips that you'd want to say?
Yeah, I think some things come to mind. I mean, I was thinking when you said that it's important that people understand that they have a unique journey, and so what works for some people are not going to work for others, and they need to think about their own unique experience and what's helpful. I think also times folks will find that in the diagnosis and as they're going through treatment, their coping skills, the things that they used to do, whether that was running or another activity, they may not be physically able to do, or they may find that it doesn't work for them as well. So it's important to think about kind of a wide range of options and to try things that maybe they haven't tried before. I think on the caregiver side, it is important that families think about setting up things like meal train, and that will help patients when they don't have the energy to do meal prep and to engage in healthy cooking, and then to also check out with the patient what their specific food needs are. So, people have great intentions and they really want to help, and a lot of times it's hard for them to know how to do that and what specifically will be helpful to that person. So I think advocating for oneself, but also people taking an active approach to how they're helping folks and asking questions about what's useful and kind of what they need right now, and that's going to change over time. So, today it might be childcare, and at another time it might be trying to figure out how to re-engage in work or something like that. I think just having that kindness towards oneself and really understanding that you will feel differently, there is hope, and that we know that people 5 years out generally look like the general population in terms of their mental health diagnoses. So even if they have depression or anxiety early on or experience that throughout their treatment, they can expect that can be better. And depression and anxiety are two things that in the mental health world we really know how to help people with. So I think that encouragement and remaining hopeful is really important, and then also having the perspective that things change as they go through this journey.
Yeah, I think that reiterating that point of survivorship looks different for everyone, and there's not a right or wrong way, and trying to break through any of that judgment that people can place on themselves.
Yeah, it shouldn't look like one or the other. It's different for probably every person out there.
Yeah. And I think the disclosure aspect is something we haven't touched on, but I think that can be an area to also seek support of figuring out how to get the support you need, and therefore disclosing in order to get that support. But also knowing that in the workplace, there are things that we want to be mindful of, folks want to be mindful of when thinking about disclosing in different spaces, so that they feel in control of that information.
Just kind of choosing who you share your information with, kind of thing.
And knowing your rights, knowing your legal rights, knowing about medical leave and seeking accommodations in the workforce. And so there can be lots of layers to that. I think always wanting it to be a form of empowerment to keep in mind.
Okay. Well, I want to thank you both for joining us. And again, if you have any additional questions or comments, you can post those and I'll get them answered for you later. And it's Breast Cancer Awareness Month, so all this month at 9 Health we are focusing on breast cancer awareness. We talked about food a little bit. You were talking about meal prep. We are going to talk to a dietitian who's going to show us some good things to make for cancer patients, good things to make for also cancer prevention. Reducing your cancer recurrence risk, those kinds of things. So that's another segment we'll be doing later this month. But again, if you have any other questions, post them in the feed, and we're going to sign off from here. Thank you, guys.
Thank you. Thanks.